Welcome to a breast health panel. Now we would like to introduce Ketlie Jolimeau. She is the Mammo Radiology Technologist at One Brooklyn Health.
Hi, my name is Ketlie Jolimeau. I have been working in Kingsbrook, Jewish Medical, for 19 years as a mammographer.
Oh, wow. That's a long time.
Yeah.
So you love it?
I love it.
That's amazing.
I love it, yeah.
So I do want to get into the risk factors because we did go over how we check, how we self-examine. So I want to elaborate more on what the risk factors are that increase a woman's chance to get breast cancer.
Okay. There are a lot of them. So I'm going to say a few of them. For example, being a woman is also the first risk. A person that smoke increase the risk. A person that drink, that's also increase the risk. The way you eat, okay, it's increase the risk. If you are a person who just lays around, who don't do nothing, who don't work, who don't exercise, okay, it's also a risk for your breast, okay. If you are a woman, for example, who had children and you never breastfed, it's also a risk to breast. And the way you eat, your eating habits also is also a risk.
Risk of breast cancer. When is the real time that you're supposed to start checking for your mammograms?
Okay. The real time you're supposed to do the mammogram is when you turn 40. But a woman can have a mammogram before that time also, because cancer happens at any age, okay? Because I remember I had a patient who was 19 coming for a mammogram. At 19 years old, the woman had cancer. So cancer can happen at any time. So, but the regular time, the real time to start is 40. It's at 40. Also, if you have family history, you start at 30. You start a little bit early, okay? And sometimes you can even start at 25, you do an ultrasound, okay? When you turn 30 now, you do your first mammogram because you have that gene in your family and things like that. You want to make sure you're okay, you start a little bit earlier.
So for someone that you said your patient was 19, so she would have had to know all of these, risk factors and preventable measures that we're talking about in order to even know that she had breast cancer.
I don't think she really know about all that risk, but because she was a young person.
Of course.
She doesn't even know what was happening to her body until she saw something just happen, and then her parents take her to the hospital and then do a sonogram first, because we don't do a mammogram under 19 years old. We will do a sonogram first. So according to what we see, now we end up doing the mammogram. And really, it was serious for that patient.
It was serious?
Yes, it was serious. So cancer really can happen at any time, at any age. Anybody can have a breast cancer.
This is absolutely why these type of events are so necessary, because it can happen to anyone. Is there really an age limit? Not necessarily.
I don't think so. I don't think so, but I think study proved that at 76, women can stop having a mammogram. I said, no, because I see people coming that are 90 years old, and then they come for a mammogram, then they have a cancer. So I think it's a taboo to say that women should stop having a mammogram at certain age.
I do have a question for you, and it's based off of the plastic surgery world that's going on right now. So right now, breast augmentations are number 2 in procedures done in the U.S. Everybody's trying to get their mommy makeovers, their breast implants. So the real question is, does the breast implants and the breast augmentations affect women getting their mammograms? And could their implants compromise their mammograms when they do get it checked?
Okay. It doesn't affect them to get the mammogram. Yes, but it could be. The reason why, because of the implants is there, we might not be able to pull out enough tissue to see everything. That's the thing. And the implants might block some areas also. We might not be able. Because these patients who has the implants, they have special views that we do for them, okay? We have a view that when we push the implants back, and then we try to pull out the tissue because of the implants, sometimes we might not be able to get all the tissue out. Therefore, we might miss some area. That's the only thing. It might compromise
But they
the
are
quality
able.
and the film also.
But they are able to get their mammograms.
Yes, they are.
It can affect it in some slight ways.
In some slight way, we might miss some tissue.
Okay.
Yes, that's it.
Okay. Well, thank you so much.
Thank you.
For coming, Ketlie. I hope that you enjoyed the conversation, because I did. I will definitely be taking some of this information back with me. So yes, it was a pleasure talking to you today.
Me too.
Thank you, everyone, for coming out to a breast health panel. For more information, visit www.onebrooklynhealth.org.